that time of my life where I was a trauma nurse, I worked in level 1 trauma centers, it really taught me one huge lesson, which is that we really don't have problems. Problems blindside you. There's a saying that when when you have your health, you have 100 problems, but when you don't have your health, you have one problem, right?
Yeah, right.
And so when I used to see it, when I worked in the ER, I saw most people on the worst days of their lives, right? This was when you would come into the emergency room. And what I realized is how precious life is. And so I think it translates into what I do today, because I'm really able to sort of help women in their mindset of, oh, I'm turning X, my birthday's coming up, I'm going to be X age. And I try to remind them how lucky you are to have that birthday. There's so many people who would have loved to have a 40th or 50th or 60th birthday. And it grounded me in that way. It also, everything else is spilled milk, right? When it comes to the problems. And I think I grew a really deep appreciation of our geriatric population. I call them the wisest among us. Yeah. But there's such a, I think that finding some dignity in a setting like that, especially in your older years, is so important. After I worked in trauma, I did hospice for a few years. Hospice holds a really close place to my heart, because I had felt like I had seen all the worst ways of dying. And so to be able to give somebody the gift of some dignity with their death, to be in their home, to be surrounded by family. The trauma room is a place where you are, stripped naked, you have IVs, we have things all over you. It's a very dehumanizing situation. Yes. And in certain situations, it's exactly what you need, because it's life-saving. But when you're looking at somebody who's in their 90s and it's like, what are we doing? Why are we, I think in Western medicine, they view death as failure, right? So they do anything to prevent that one thing. But really, there can be, death is normal. Everybody's going to experience it. Yeah. And if you can find some way of really giving somebody dignity with it, it can really translate, especially for the family who have to live without them afterwards.
I mean, and we could cut this out or talk about it, but we experienced that with our dad. Like we were with him till the very last breath. I mean, we counted down how many breaths were left at the end. And that moment was all about giving him that dignity. Yes. Making sure that he didn't, because, he couldn't talk, but we know he would not want us to be having to care for him. Exactly. And so it was like, we got this, Dad. We've got you. Like, it's going to be okay. Yeah. So that end is very similar for everyone.
And it's so, that is a gift that you and Andy have too, to have had that moment with him where you weren't in this bright lit, sterile.
I can't imagine.
Not only did you give him a gift, but you also have the gift of that memory, because so many people don't, and it's sort of instantly gone. It's ripped away. Right. Yeah. And so anytime you have the power to be able to pick your setting and give that to whoever's there, I mean, it is truly a gift. I've seen both sides of it, and I think I have a respect for death and understanding that it can be at any moment, and sometimes you can't predict it. And so for that reason, I really appreciate everything else. Yeah. So, and I think maybe it's part of my mission. Not only, beauty is one side of a woman. Wellness lives in the same woman. So beauty and wellness are both part of the same person, and they're not separated. And to be able to have somebody not only, have beautiful skin, but then to realize that every day they have is a gift, to really push that messaging with every appointment and with every patient that I see, it translates to the rest of their life. No,
there's a direct correlation.
This is Unlikely Bosses.